I'm going to turn this over to Marcia Bohannon, who's our Chief Information Officer. Today we have an information item for you about our research request. So staff will give an overview of the process that CDE has gone through the review, and then we'll hear from the requesters about the details of the data that they're requesting and the reasons for the research they're trying to do. Thanks.
Hi everybody, I'm sure you're happy to see me again because it's been a while. We love talking about PII.
We got you your money and you never come back.
Well, I'm not asking for money today if that helps, so but I might come back later for that. Anyway, I'll just sort of start us off here. This is another research request. It actually started in 2017. The initial request came quite a while ago. And we put it through our process, and there was some work with the researchers here. And we ran into the challenge we have with the IRB approval. And you talked about this at the board meeting last October. And we kind of worked through that, but that's part of the reason why this has taken so long. That this research didn't really qualify legally as an IRB item, and IRBs would not review it and approve it. So we had to come back to you and make sure that you were okay with that, leaving those kind of requests, or leaving the IRB approval part of it out of those types of requests, just because we couldn't get that. So that's part of why this has taken so long, and this was the next available slot on the agenda. So I just wanted to kind of lead off with that to let you know, because if you look at the timeline on this, they've been very patient. So also I just wanted to remind you that our role in this, since it has been a while since we've brought one of these to you, is to facilitate the process. And we did that in this case, and we complete with the internal process that we follow. And we also met with a couple of board members, with board member Goff and Rankin, to review this and get their questions answered. So so we went through the full steps. So we are here to kind of lead it off. Jill's going to tell you a little bit more about it, and then we're going to have our friends from CDHS do the majority of this, because they've got the answers and the details of the research. And I think that's pretty much it, and I just kind of walked you through 2 slides without showing you the slides. So.
All right, so this is a little bit more information about the RAP process in case it's been a while. So as part of this process, we go through a rigorous internal review. As part of that, we have started using a worksheet, which is included in your packets. That is completed by each of the members of the RAP, the Research Approval Panel. And it goes over the questions that we sort of talked about and established when we first approved this process back in 2016. What we do is we consolidate all those answers, kind of get the feedback from all the RAP committee members, and that worksheet is in your packets. So as Marcia mentioned, this does not have a IRB approval because it does fit outside of those requirements for IRB approval as stated in law. And so we won't have that, but we have gone through all the rest of the processes involved in reviewing and evaluating this request. So what I'm going to do is I'm going to go ahead and turn it over to the people who know the most about the research. Dietrich and Ashley Brock-Baca and Dietrich Godinez are here. They'll be able to answer your questions and talk to you about the research and what they're planning on doing.
Hi, I'm Ashley Brock-Baca, and I'd like to thank you all so much for the opportunity to come before you with this research request. Dr. Godinez and I both work for the Department of Human Services, and we are involved in developing programs and services, particularly to meet those, the needs of children and youth who have behavioral health challenges or families who have complex needs. So that's really the line of program development and research that we do. So the information that we are requesting is the data about students who have individualized education plans across Colorado. So we're asking for several years of data. And the intent of the research is to merge this data with what we have already existing data from the Department of Human Services and other agencies. So we already have data that we've provided reports to you documenting their student or child and youth involvement in the Division of Child Welfare, in mental health services, substance use services, the Division of Youth Corrections, now known as Youth Services, and those who are served by community-centered boards with intellectual and developmental disabilities. We would like to have education data to kind of complete the picture that we have about the needs of children and youth who are multi-system involved. And so that's really the kind of the overview of what this research is about. So we know that there are many schools in Colorado who are struggling with students who have really complex needs. And we have a CDHS program called High Fidelity Wraparound that is designed to meet the needs of those children and their families. And the goals of the wraparound process are that children and youth will be at home, in school, and out of trouble. And so we want kids to be living at home in community settings. We want them to be attending school regularly, and we want them to be able to stay out of trouble, meaning out of trouble in school, out of trouble with the law, or any other forms of trouble. And the research that we're conducting is really designed to help us get a complete picture of all the needs that these children might have and their families. Because our systems are somewhat fragmented, there's no single system that serves all of the family, all of their needs. So they might have to get services from different agencies and be involved in different systems when they have complex needs. So the wraparound process is designed to help all of those different agencies and systems provide care to that child and family that is comprehensive and is integrated. And one of the things that we have a goal for within the process is one family, one plan. So rather than having families have a different plan with every agency that they're involved in, which can be really confusing and difficult for families to manage, we want each family to just have one plan. And of course, the education needs need to be integrated into that plan. We've done other research with families who have a child who might be system involved or is struggling, and the parents consistently report that their child's education needs are just really their highest priority. And it's one of the things that they're the most concerned about is getting their child's education needs met. And we know that we can't have comprehensive services or a single plan for a family if that plan doesn't include the child's education needs. And it's necessary to include all of the needs in the plan if we want to comprehensively address the family's needs to prevent worse outcomes during these critical years when children and youth are developing. So within our programs as they exist now, at the local level, the schools are collaborating really well with the CDHS services. We receive a lot of referrals into services from the local schools and districts. And when children and youth and their families are involved in services, they see a lot of really good collaboration with the local school districts. However, we currently don't have any statewide data that we're able to use in our kind of program planning, especially for statewide expansion and for budgeting and things like that. And so that's what this request would help give us what we need to plan expansion of our program around the state. So I do a lot of work with schools around Colorado. I often do training for schools. I work closely with the ESS unit at the Department of Education, and I do some consultation. And over, what comes up is that there are students who have really complex needs, and in almost all of those cases, there's also some complex family situations. And we recognize that it's not the school's responsibility to address all of those needs. We have to do that together across agencies. So we really have to work together to best serve these families. And that's really what we're asking for, is the data that would help us to include the education needs in this comprehensive approach to serving children and families. So I'm going to turn it over to Deetri.
So thank you for allowing us to present this proposed research. So the main goal is to get a complete picture of the experiences of youth and families in Colorado. As Ashley said, we consistently hear from families and service providers that, one, they are working with multiple systems across agencies. And then two, that education is a high priority to them. So this research comes from that desire to include educational research, specifically IEP data, in our understanding of cross-system utilization. So the main benefit is really for the service providers, including educators, as well as the families and youth, in that this research will allow us to improve training and cross-collaboration, coordination of care across systems, appropriate referrals, and then justifications for increased funding to serve youth that are involved in multiple systems. And so this research will not only help CDHS in improving our understanding of educational needs for the children that we serve, but it also has the potential to help CDE better understand the more complex and complete needs of youth involved in special education.
All right, so in addition to being able to include educational needs of children and youth in the sort of statewide data analysis that we're doing in order to get that complete picture of the needs, we also have a couple of concrete steps that we will take based on the results of this research. So the first is ensuring that CDHS adequately plans for staff across the state who would be able to provide those wraparound services. So the wraparound services, again, are designed to improve the care of children who are involved in multiple systems, and having an IEP is an indicator that they are getting additional education services. So we consider that one of our criteria that might indicate, when combined with other system involvement, that that child and family has some complex needs that they might benefit from wraparound services. The second thing is to ensure that we develop a statewide process for families to be able to make, for schools to be able to make referrals into wraparound services for students and their families who have complex needs. So currently, we have a lot of local communities who are providing wraparound, but we are in the process of developing a more statewide, consistent approach to delivering these services. And we want to ensure that every school in Colorado has access to a community provider where they can refer families that might need these services. And the third thing is ensuring, again, that those educational needs of the child are included in the family plan. And that may mean to us, in very concrete terms, that we need to provide more education or more training for our staff, the wraparound providers, to ensure that the family's plans are able to integrate the educational needs in a way that meets the education system requirements or mandates. So we might need, for example, to better train our staff on IDEA law or something like that. And then secondly, we may also need to provide more training to school staff on how to work within wraparound teams. So I think there will be some very concrete benefits to schools and to students and to their families if we are able to get this data to help us form this complete picture of the needs of children and youth with complex needs. Thank you.
So what we'll do is we'll turn it over to you if you have any questions or anything you'd like to follow up on.
Questions? Board Member Rankin?
I went through this program, and I was kind of, in the beginning, had one thought, and then when I listened to you talk and read all your handouts, I kind of had another one. And I represent a rural area, so all of your services, a lot of them are community-based. We don't have community-based services like you're looking for. And I know you deal probably in the bigger districts where you have a lot of services, and so you're trying to get the right ones for the right kids. But if you don't have those services available, or you have one student in the school that is what's the term you use? High utilizer, high needs student, that you have to have one full-time person with that student all the time. The picture of the state is going to look a lot different than the picture of the unique districts and unique students and unique communities that I have on the Western Slope. Now, I came to page 3 because I was concerned about what's the goal of all this. And one of the comments here, does the research benefit vulnerable populations? Well, it sounded good from what you said, but then the comment here is the primary use of the research is to improve the services and increase the funding to those services and coordinate services across Colorado agencies. If our goal is to increase the funding, we're going to prove that no matter what. I have a feeling the answer of this is going to be we need a lot more money. So I don't know if that should be the goal, or let me back up a little bit. I'm sure you've done a report on what we have now available before you even want to see. I mean, to look at everyone, how much money is going where, which ones are. I mean, right now, you probably, I'm assuming that you have all the information of where we stand now, because if we don't, the goal is just to get more money. Well, I mean, we can go down that rabbit hole, but it's never going to be enough. It's never going to be enough. You'd be the first one to admit that to me, too, I can tell. So I'm looking at it totally differently as to I'd like to see what's going on right now and where the services are. And some communities do not have any of these. Are we going to send people over there to help? And what happens when these students graduate or get older and move on? There's a whole different group that replace them with different needs. And if you're in a community that does not have those community services, I worry about taking all those into the school and having so much on the teachers at the schools that it's just impossible to meet the needs of anybody. And that's my talk for today.
Do you have an answer?
Yes.
Please, go ahead.
I
please.
think there's a couple of things you mentioned. A lot of that certainly resonates with the work that I do with communities. We do have many rural communities who provide wraparound services. So Montrose, Gunnison, Mesa, all on the western slope, the San Luis Valley, Montezuma. We have a number of rural areas. And I think one of the benefits of using the wraparound approach is that it helps develop the family's natural supports. So that's an integral part of wraparound, is that not only are you trying to provide more community-based services, but you're also working to increase the family's natural supports and coming up with creative solutions.
What define natural support, please?
So a natural support would be someone who is not paid to support the family. It might be an extended family member or a neighbor, a member of the faith community. And so the wraparound process actively engages all of those natural supports, as well as the people like mental health professionals or schools who are paid to support the family. And we've seen a lot of successes in rural areas using wraparound because when you kind of get down to the root cause of families' system involvement in the process, it's a very family-driven process to allow the family to identify their prioritized needs rather than sort of the systems telling them what they need to do. We often find that there are creative solutions that can, be come up with a team problem-solving approach and utilizing those natural supports. And so, for example, in the Montrose School District, we have worked with their attendance advocates in the school, and they've been able to work with families who were referred because of truancy and come up with sometimes some really creative solutions. And of course, that doesn't address all of the problems. There still are a number of children who have really intensive needs, and I certainly work a lot with schools, and there are kids who need a lot of para support, and this doesn't necessarily address all of that. But I think it's about using the resources that we do have. We have been able to get some more grant funding based on the previous research that we did. So I think that there is some possibility of getting more funding, but it's also about maximizing what we have and using those creative solutions and innovations and natural supports when we're in low resource areas.
So have we documented all of that? Are we currently working from something that we know exists and exists in certain communities?
Yes. So wraparound is actually the only evidence-based care coordination process for children with mental health challenges and their families. So recently, the federal government convened a group of experts to look at all of the evidence for different types of care coordination for families with complex needs who have a child with a mental health challenge. And wraparound is the only evidence-based care coordination process out there.
What do you mean by evidence-based? Do you mean what is going on or the outcomes?
That the process leads to positive outcomes.
And we have reports on that as to what's going on right now.
Yeah, so there are some published research, and then we have some reports
For
on
Colorado.
what we've done in Colorado that show that we are really working to achieve and have made really great progress with that at home, in school, and out of trouble. We've had tremendous success with the counties that we currently have participating in the process, and that's why we want to expand it, because we've seen success with some really, really challenging cases across the state.
I'd like to see the numbers.
We can certainly provide that.
Were those the reports that you gave it to us?
No, we
Oh.
have additional evaluation reports that are specifically about the kids who are already receiving services. So this research request is really about helping us understand the statewide need, which is why we're looking at all the kids in the state who are involved in systems or who are high utilizers of systems. But we additionally have data on the much smaller number of kids who have already been receiving wraparound in Colorado.
So what we are providing is the educational arm of all of that study. But yours is a huge umbrella over that because you have the community, the social services, and all of that.
Right.
It sure seems very complex to me, and I can understand how we keep trying to expand, but to understand what's going on right now, and unless you address an individual in some of the communities I deal with, there's very few kids that are those high needs students, and the resources are just not available. Now, if it's what the parents or the caregiver, and then you're talking about that in the school and the community, and that doesn't, and there's no charge there, that's a whole different thing, and I don't know how you can track all that. But, and I know our job here is just to give you the PII or the individual information, and I respect that, but I think there's a lot of gray areas here that I think we as a board should have some answers, but I think the legislature, it's a very costly program, and to say the goal is to get more money, it just doesn't sit well with me, and I know you've heard this before.
Board Member Flores.
I think in my community, which was a farming community, I just want to speak to your question, and a farming railroad community, and it was working class, and we didn't call it wraparound, but when it was learned that there were several children and adults with who had what's the sugar blood disorder? Diabetes, thank you, yes. Then, parents in both a Mennonite church and a Catholic church got together. These were the mothers, and they were able to then exchange information. And then, because one of my cousins worked for the county, my mother was able to talk to her, and then they were able to get someone who came in and who taught classes on how to, what to eat, better recipes and such. And so some of them were carried, the classes were at my home and other homes, parents took that on. But I don't know how much that cost, seriously, because I don't think there was, other than possibly tools, and I think everybody contributed in the community. And this was not a community that had loads of money where we got $100,000 to do it or anything. It was all done by the community, and it can be done. It was pretty isolated, several miles from a city, and so it can be done. And if people get together, and I like the idea of, that it is grounded in families coming together. And I think that there's a lot of young people today who want to start, these programs. I know that in Denver, we had, I guess, some people that were really interested, and there were young people, of people in some communities not having vegetables and such. And so they started that. And so I see very positive things kind of coming from this, and that it can be done. It was done, over 60 years ago, and I can see how communities can come together. So I'm happy that you're working on this.
Thank you. Board Member Sheffel?
Why would this not be a violation of Part B of the IDEA, where it's required to have informed parental consent to access any IEP data?
We determined that because it's borderline whether or not it's personally identifiable. The only information we will be providing is the first three initials of the last name, the date of birth, and a code for gender. That's the only direct identifier that will be provided. So while they will have, it's borderline about whether or not that can be identifiable without a significant amount of work, but we felt that it wasn't identifiable enough to bring that in.
It strikes me as, you're saying it would be a lot of work to track it to a student with those data points. I'm not sure I would agree with you there. So I feel like this is just a huge intrusion of privacy for parents whose kids are on an IEP. I mean, I can't imagine. It sounds like you want to really analyze these wraparound services, but I don't see a huge call for parents saying, please release my child's PII data so that you can analyze the needs across all these databases in the state. This strikes me as a major data privacy issue.
We are also only providing them with a yes/no flag that they have an IEP and the primary code for the reason.
Right.
So we're not disclosing all of the information in the of the IEP. It's just whether or not they have one and what
But
is
it's the
primary
category,
reason.
right? And then you're linking it to other databases so that now you'll have a bigger picture, including those data fields and then mental health issues and a host of other issues, where you're putting that all together. I just think parents I know wouldn't want that to happen.
So if I may address this question. So when we use that information, the main reason we need it is really just to match across systems. And immediately upon that, it's de-identified. So I take out all identifying information. No one, you just won't even, there isn't that possibility really, because by the time anyone else would ever see the data, they have none of that identifying information. And the ID is a hash ID, so it's just a made-up random number, and then that becomes the predominant link between the various mental health versus the IEP data.
But isn't the purpose of this to set up this cross-system utilization?
Yes, but
so that you want to be able to link these things together, and this is the first step in doing that.
Right, but that's all aggregate data, so you don't know who those people are. And like I said, at that point in analyses, all of that information is stripped from the data, so you couldn't even do it even if you wanted to. And it's not important to us, who those individuals are, so there's no privacy risk in terms of what we do. It's really how, overall, what is the percentage of individuals with an IEP who also are being served by child welfare, who are also part of the Division of Youth Corrections, right? That's the aggregate level of data.
So I appreciate it, and yet when I look on slide 6, it says the purpose to link CDE's PII to PII from other state agencies, developing an identification number for students that, it doesn't strike me as all this aggregated data where you don't care about the details. It strikes me as quite detailed.
That's just used to match it. I do agree with you that I think it would be ideal if we had anonymous identifiers across systems that would allow us to do this, I would love it. But we don't. And so this is the only way that we have capacity to cross systems at this point.
And yet, one more comment on slide 7, designed to integrate and improve care for children and youth involved in many systems. I mean, there's definitely a goal here where you're integrating systems. And so again, I hear that it's research, but it strikes me as more than that. Others.
I think I'd like to answer that question. So the goal is that the services that will be designed allow that integration, but that's not based on the data. So the data are kind of giving us the idea of how many children and youth in Colorado might be eligible to be offered this service, but of course wraparound services are always voluntary. Families don't have to participate in any type of service that they choose not to. But if we wanted to provide, and we want to provide the services to any families who might need them and who might choose those services. So it's about getting the right numbers to help us plan for expansion of services across the state, rather than looking at individual students. So we're not going to use this data to identify specific students that we're going to try to refer into the program. It's to help us plan statewide, what are the numbers, how much do we need to budget, you know, as we think about hiring staff to be supported in the local communities, how many families might be eligible or who might need these services.
How do parents opt out? Do they have to opt in? Can they opt out?
Oh, they would have to be engaged and referred and follow up on the referral if they want the services. So
No, as far as the PII, sharing PII, how does a parent opt out, or do they opt in?
so this would not be an opt-in or opt-out.
No opportunity to opt out?
There wouldn't be an opportunity to opt out of this if the board approves this.
There would be, or there would not?
There would not be.
There would not.
Yeah, I would also add too that all of this is existing data. And so that, you know, comes back to this level of research that we do. You know, we're not asking for this identifying information to identify these individuals. And then it's all existing data that already exists. So they're not adding anything. We have no intention of contacting any students ever, right? Like none of that will ever happen. And I guess the other thing, just to add, you know, as a state employee, I take privacy and PII very seriously. You know, IEP data is probably the least of the concerns of the data that I could, if I wanted to, misuse. And so it's not at all, you know, it's something that I take very seriously, and I've worked a lot with children and adolescent data primarily. So I also really respect that these are children and that this research is really used more on an aggregate form for us to better understand, you know, the entire process across systems. And I think also to speak to Board Member Rankin's interest in, you know, it's not just about asking for more money. It's about coordinating care across systems. It's about training needs that are already being funded, but we need to know a little bit more around what those training needs are. And then the other thing to add is we do a lot of research that is outside of this research. So we just finished a service array assessment, which I think that probably answers more of your questions around what is the current state of services and what are the barriers and challenges to them accessing some of those.
One short question.
Just a minute. Board Member Goff, did you have your hand up? Kind of doesn't work for me. It's a yes or no. It's a binary.
I gotta commit. I wonder if there's a way to cite a simulated circumstance or an example. If IEP information was available, period, doesn't matter if it's one single child or a family, a group of families who also share an IEP plan, I don't know. What would you find to be really beneficial? And I think our CDE people can probably weigh in on this too. If there was enough information available to show, here's how we can coordinate something. And when we think educational plan, we think learning access to content. We think purely educational things. I know in the bigger world that word is bigger, so it could be anything. But if you were encountering, or you had a parent sitting in front of you who had a child on an IEP, and no matter where they live, there are community services that are available. How would you talk to them about the benefits to their child's education by having that new information? I guess, I don't know. I'm just looking for real life, day-to-day, on-the-ground ways of how you talk to not only families, but also schools and us.
So if I'm interpreting this correctly, you want an example of how a child might benefit from us having data about their education and receiving wraparound services?
Yeah, and it could be, a round robin, a 360-degree benefit type of deal. So how would the local or in the community department or agency of human services coordinate with how will it look when we've got a real coordinated life for someone,
Okay.
which also includes their IEP information, which talks to things that happen at school, that need to happen at school to guarantee the best education possible, or how this child the program is set up for the best learning experience. Just examples that, how does each agency benefit?
Okay.
Pick 3 or 4 agencies.
Okay.
Programs.
So let's take a hypothetical example of a student who may be on an IEP due to a serious emotional disability, having some struggles within the school environment, and also perhaps some learning challenges. So that student may need some outside of school care to address all of the underlying needs. So perhaps there's care from a mental health provider, but maybe the family has some other complex needs in which sometimes it's difficult to get the student to the school, for example. If that student were able to be referred by the school into like a very warm handoff to give the family the option to participate in wraparound services, then the family would receive care coordination from the wraparound provider, as well as a family support partner who's designed really to just kind of be there to support the parents or the family, to help kind of identify what are those underlying needs that might be impacting some of those things that are coming up in the school setting and possibly also in the home or the community setting. And that's when that process of engaging the natural support. So for example, if there's a transportation issue of getting the student to school, that might be something that a community support, like a friend or an extended family member, might be able to help solve that problem to get the student to school more consistently, which of course will improve the academic outcomes and everything else. And then maybe there's also a problem with transportation or something else of getting the student to maybe the community mental health center is a 35-minute drive, and it's difficult to get that student there to get the services they need. Within a wraparound process, there would be a team problem solving about how do we address this barrier that this family has to get that student the service that they need. And so I think the school benefits by being able to partner with other agencies in the community to help serve the child and family. So it's not the situation which I feel like I hear from schools all the time. They feel like they're left holding the baby, so to speak, because there's a lack of coordination between the school and the other agencies in the community who are serving children, youth, and families. So if there's that closer partnership, the wraparound process gives those staff a evidence-based, structured way of working together to address the specific problems identified by that family. And again, we just feel like the education needs have to be included in that because the parents identify that the child's education is so important to them. And we just know from all the research that the child's education is a huge predictor of their long-term outcomes. So we want to support the child's education. It's one of our major outcomes. So I think the school benefits from a place to refer the child and family, but also to continually partner with them. So it's not just like, here, go call this person and we hope you get services. But if the family chooses to engage, then there's an ongoing partnership between the school and the wraparound team. And then the family benefits from being able to kind of address all of their needs in one plan, rather than having this situation in which the mental health provider gives the family a plan, and then the school has the IEP, and then maybe they somehow get involved with another agency and they give them a separate plan, and then the family can't manage all of those competing priorities, especially when those don't address the family's real needs, which might be something like transportation is something that we see a lot of times, or something really concrete and simple that as a team you can solve those problems together and be creative.
So, if I can
Let her finish.
follow up, to refer back to Member Rankin's prior question about depending on, you know, if there's a region of the state where there is a student and probably already identified in need in one category, sorry, or another, but I guess part of my question right now still is what is the definition in this case of community-based? Is it strictly agency-based? Because we have agencies, which we share, you know, one. We have agencies that address these needs. But if we're talking about the development and the building up of community capacity, so when if perhaps in a family, if transportation is the challenge, then the agent becomes the family or their associations or their allies in life and so on. I guess you know, I don't know. I think I do appreciate though, in a really small community, where if you hear the word state agencies, well, it's either, in some people, it's cut and dried. We don't have that here. So automatically my response is I'm cut off from that. I don't have that benefit. But whereas agency with a small a in equaling human capacity and taking action is a whole different thing. So if part of this helps to develop community capacity by training or by outreach or just coordination, that's one thing. And I have another question about that related to money, which I rarely bring up money in any of these conversations, but I you know, at some point we could talk about that. What's important to me right now is where solid examples, I think, are needed, perhaps only for the 7 of us, but also if this is gonna be talked about with schools and districts and their interest in the PII part of our lives. And I think it's important to I appreciate and I understand. It's just, I'm just curious as to how we show how you're going to help this benefit your ultimate work in implementing this.
Well, she said I could, okay. May
I'm
I?
done.
Go ahead.
Sorry. Yeah, thank you for indulging me.
Well, I mean, as an evaluation person, or as a person who has done evaluation in, you know, communities, and I'm trying to think of that program that I've worked on that we all give money to, and then gives the services to other services that are nonprofits and such. I think of the efficiency of what this could do. I think of all of us are talking about pragmatism, because as a nation, we are very pragmatic. And I can see how this evaluation could be kind of a connector, you know, and it is a connector. And if the data is not going to be used for terrible things, it's going to be used to really connect people. I mean, I know when I was blind all those years and I needed to go someplace, I would just get on Facebook and say, is anybody going to this, you know, to this event and lives near me? Can I catch a ride with you? Or, you know, just stuff like that that can be done. And I can think that, that whole thing that happened as a child that my community did for people that were diabetic, I think that could have been done so much better if people had just, you know, talked online and found each other and traded recipes online and all that. And so this is what this is trying to do in a magna sort of way. And I like it. I like that you're doing that. And maybe new ideas of how to help people can come, or people can in their communities kind of see that there is a need and maybe start a business to help that need. I think that's great. I see only positive things when reading this. I see that there is the issue of, you know, keeping the PII and safe. I mean, I see that as the big problem. And I think we all need to be reassured that that's going to be safe. I think that's, for me, that's the big issue.
I think we can absolutely assure you that the data will be kept safe. Again, we handle very, very sensitive data about things like psychiatric hospitalizations and mental health needs and child welfare involvement, and many types of sensitive data are already included in our analysis. So we certainly follow the same protocols that all state agencies do to protect that information. And we would be personally responsible if there was a breach. It would be, we would be personally fined for that. That's,
Right.
you know, HIPAA law. And I know we're also familiar with FERPA law. So we certainly will ensure that there is privacy. And again, once the partially identifying information is used to match the data across systems, the files then become de-identified. Because again, we're not interested in identifying specific students. We're interested in that aggregate, the numbers of children and youth who are involved in multiple systems across the state. But there's no way to know if the same kids that we're serving are the same ones that are on IEPs without having that identifying information to match it. Otherwise, we just don't know if the kids out there who are receiving special education services might
Right.
be mostly different kids from the ones who are in child welfare or receiving mental health
Right.
services. We kind of assume there's some overlap, but we don't know the extent of the overlap without matching the data. But we can absolutely assure you that once the data is matched, all the identifiers will be removed, and then we'll only be looking at aggregate numbers so that we're able to adequately plan for capacity and expansion, and simply recognizing that a child being involved in special education is one, it's not the only, but it's one indicator that there might be some complex needs for that child and family that might mean they should be referred, that if they chose to engage in wraparound services, that would be available for them.
Board Member Dale.
Dr. Sheffield, please.
Yeah, I
Board
would
Member
just-
Chaffel, go ahead.
I would just say that I think to answer your, I would think that you don't need PII data to do what you want to do, which is letting people know the services that are out there that they can avail themselves of. For you to say that, well, we want to know if there's overlap and all this stuff, I don't see parents rising up saying, we want to know if there's overlap. You want to know that there's overlap. I don't know what really good that does. You can easily develop resources on a website or in a brochure that lets parents know these are the wraparound services available in Colorado. If you want to avail yourselves of these, or if kids need these, here's a list of them. But for us to give permission to release gender, IEP category, IEP yes or no, date of birth, which is FERPA protected, and last name, first three letters, I just think that's major data privacy issues, and I don't think you need it. If you're trying to let people know what's out there as far as wraparound services, let them know. Let parents see the list and avail themselves of what they need without compromising the child's identifying information. I think that's a major breach of data privacy.
I certainly respect that concern. And I also realize that as I am trying as a program developer to think about how many staff do we need across the state, what budget do I need?
You could see who avails themselves of the services. I mean, you're trying to get on the front end of it. let people know what's there and see who avails themselves of what. I mean, I don't know why you have to get on the front end and link all these databases together. One child, one plan. I don't know that parents are calling for one child, one plan even. Not the parents I've talked to.
I think that we have heard from a lot of families that, you know, they certainly appreciate the integration. And again, I think it is very helpful for our planning and budgeting is my response
Maybe
to that.
class. It could be a class issue as well. And also ignorance that people don't know.
Board
and
Member
they could
Durham.
Find out.
Thank you, Madam Chair. Just to start, as an attendance advocate, is that what we used to call a truant officer?
That's what Montrose School District calls their truancy officers, yes. That's just one district I've worked with.
So, I just always like to know what, exactly what terms we're talking about. I'm going to ask you about another term a little later, but, so, can you tell me what services are included in what you call wraparound services? What are they?
It depends on
Give me a list.
It depends on the family's needs.
How big's the menu?
It depends on the community. So again, it's about identifying.
What's the biggest list you could come up with?
I mean,
How many services?
I could try to rattle off a lot of things. So it might include things like outpatient mental health services, mentoring, respite care. It could include substance use services. It could include something like family therapy. It might include recreational activities to build social skills. It could be life skills training for transition age youth. It could be helping a child get involved in 4-H. We've got some success stories of things like that where that was really helped address some needs. I mean, it really depends on the culture of the family and what the family identifies. Sometimes it means partnering really closely with the faith community so that the natural supports there in the community are able to provide some protective factors to the child and youth that increase their social skills and give them some friends that they can build those social skills that help them then to better function in school and in the home. So the menu is almost infinite because it just depends on the family's needs. Some things that we certainly try to make sure are available are the mental health services. And
so why does knowing whether or not a child has an IEP have any impact on the provision of those other services?
So that when one plan is created for the family, that the education needs are represented.
Well, the education needs are by definition represented in the IEP.
Right, but if a child and family have a very complex situation, it is often the case, and this is what we see in our communities now, that sometimes there is a school representative who's on the wraparound team. So when a family is in wraparound services, a team is developed to help really kind of do that team problem solving approach. And if a child is on an IEP, it's an indicator, for example, that the school might need to be more closely involved in that wraparound team to ensure that the concerns that are happening at the school are being addressed within the family's plan. And also that if the school might know about concerns that are happening even outside of school, and that school lens is within that family plan.
How many records do you intend to turn over to the Department of Human Services?
We don't know the exact number. It would just be on those Colorado students that have an IEP, but I can get you those numbers
So
if you'd like.
every student with an IEP would be turned over?
Yes.
Well, as you may understand and may already know, that I think the parents that are most protective of personally identifiable information are parents whose children have issues, most of whom have some sort of IEP. And they are concerned that their children may be stigmatized by the use of this information. So the level of concern is significant, and while I fully appreciate that you will do whatever you can to protect the information, You know, the reality that we all live with in this society is the only safe information is that which you have not collected. So I don't know. I mean, we like to believe our systems here are safe, but I don't know if we've had a Chinese incident. And so having this data, every time this data is held in a different location, it increases probably exponentially the chance of the data being compromised. So I hope you'll understand why parents really don't want this information out in a public domain. And I think when you then start trying to link it, you have now a number of other entry points into your system which could be exploited. So I'm not sure that you can do what it is you think you can do to protect the information. And if you're just doing research, samples would work just fine. You don't need every IEP. You might need 5% of the IEPs, because if all you're trying to do is determine, do 10% of the kids with IEPs, are they in need of wraparound services, then you can get that. You can develop a statistical model that'll give you that, because I'm going to guess you're talking about, we had 900,000 students, probably at least 10% of whom have IEPs. That's 90,000 records, give or take. You don't need 90,000 records to build a statistically acceptable model to then use to answer the questions. If all you want is aggregate information, you don't need 90,000 records. You need a statistically valid number of records. So, Ms. Stacy, why is it we didn't suggest that if in fact, I'll take them at their word, that they don't want this data for any other reason than to build a statistical model, why didn't we recommend a number of records that would allow them to do that?
We talked about how best to do this, and to see if there was ways around providing the certain number of records and that sort of thing. We didn't discuss that particular option, but I don't know enough about statistics to really be able to say one way or the other.
Well, we have
what's
people who
needed.
work in this department that clearly do. And if you don't, I can give you a phone number of a good pollster who can develop a statistical model for you, if that'd help.
So I have a potential solution, because I think that as I'm listening, I can understand your concern. What if we just destroy the data as soon as we de-identify it, right? Because I like to keep it just in case I need it again, but I think it would be within reason to just, as soon as we merge it across systems, just destroy any de-identifying information completely. So there isn't that potential for any sort of breach because that data no longer exists in our possession.
You need to answer the other question
And
first.
then-
Why are you opposed to developing if you're just doing research, and I'm not getting the answers that would lead me to believe you're just doing research, but let's presume you're just doing research. Why would you not come up with a statistically valid model, and if you need 5,000 records, you have the department give you 5,000 random records. If you need 10,000 to develop a statistically accurate model, you get 10,000 records. But there is no justification. If in fact you're just trying to find out the percentage of people out there that need the service, and then you can extrapolate from the 5 or 1,000 or whatever the statistically significant number of records is, that's not hard. That's not hard to do at all. So you got to answer that question before you tell me what you're going to do with it, how you're going to destroy it or whatever else. So tell me why you cannot build a statistically acceptable model and come to this board and say, in order to do this, we need 1,000 records, 5,000 records. If you want every record, that's too much. It makes no sense whatsoever.
I think that something like that could potentially work as long as we also got a random sample that included a certain number of kids who don't have IEPs, because otherwise when we match them, then we wouldn't know, are they simply not matching to our records because they don't have an IEP, or are they not matching to our records because they weren't in the sample that were given? Because for all of the other data systems, we have for every child in the state. So we have for every child in the state, the child welfare data, the mental health data, the developmental disabilities data, and the Division of Youth Services data, and the substance use data. So
Of those children that are in that system you have.
yes.
It's not every child in the state. It's every,
Right. So it's every child who's
You don't have
touching-
900,000 records.
I don't know exactly how many. We have several 100,000 records in total. So I don't know the exact numbers. It's been a
Of
while.
current students, or some of them have passed,
Right. So
'cause we only
we
have
have
about
years.
940,000 students.
Yeah, we have several years of data from all of the other systems. So it may be possible to get a smaller number of records as long as we also get within that random sample the students who don't have an IEP, because otherwise we wouldn't know why they don't match to our system. So that would be
Because they're not in your system?
right.
So you know.
Well, unless they simply weren't in the sample that you gave us. So if we have 100% from all the other systems, and let's say you give us 10% of the records from education, if a child is in our system and they don't match to your system, unless we also have the random sample of kids who don't have IEPs, then we don't know if our kids didn't match to your data because they're not in your random sample that you selected, or because they actually don't have an IEP. But we could potentially come up with a smaller number if we also got the data on students who don't have an IEP.
Well, I just will tell you and I'm not a statistician, but I've done an awful lot of work on sampling and polling over the years, and I can just tell you, you're dead wrong. I mean, you get the right size sample, you can tell how many left-handed Lithuanians there are. So it's not that hard. The science on this is easy. There are lots of people who can do it, and you ought to be figuring out how to try and do it before you come over here and ask for 90,000 records. Because I don't doubt you will do your very best to protect the privacy. You in fact may be able to do it, but there are going to be a whole bunch of parents out there I've already had a couple of texts on this, who are not going to be at all happy, and there are going to be a lot of parents who are not going to be happy that their children have been identified to yet another agency as having an IEP. And you're looking, it appears, what is it? What's the problem you're trying to solve? Not enough people are requesting wraparound services? Is that the problem you're trying to solve?
No, actually, we have somewhat of the opposite problem. We have waiting lists in some communities to get wraparound services. So we have currently not enough staff, and we also don't have services in every community yet. So there are counties that don't have these services. So we're trying to plan what is the capacity that we need to have to serve the families out there who have this need. And it is difficult to come up with a budget for how many staff we might need to support through a CDHS program without all of the data.
Board Member Schaffel.
So I guess I too am confused with your research question, because when I look on page 5 of the PII rap sheet, number 14, it says, are there alternatives to providing PII? And bullet 1, the entire point of the study is to identify these students. So yes, PII is needed for this study. I mean, it sounds like now you're saying your more general question is, it's like a different question. So I would say that there's a lot of confusion about what you really want to know and why, at least in my mind.
The PII is needed to match. So again,
But you're matching so you can identify students. If you're just trying to identify scope of need, I think you could do it without PII. You do a survey. You can look at how many people are on wait lists. You can
Yeah.
look at what services are available in which communities and which ones are not.
It's
I
about
don't know why
knowing-
you need PII.
sorry, I didn't intend to interrupt, but it's about knowing whether a single child is multi-system involved, and
Yeah,
that's
that's
the
the
need to
problem.
match.
Can I read
Board
it?
Member Rankin.
Yeah, today was for information only, and I appreciate your efforts and what you, and I truly believe you believe that you will keep it all PII, that nothing will get out. But I do want to, without belaboring this, I have only to work with this worksheet that Dr. Shuffle just referred to, and I'm looking on page 6. And it says researchers can only conduct this research using a unique identifier that uses the first 3 letters of the last name. The board has prohibited us from giving researchers student names. This is not the full last name, just the first 3 letters, but I still believe that to be identifiable. However, our processes will ensure that this information, like all the other PII provided, will be protected. I will rely on the board to determine if this is worth the risk, but I believe it to be so.
Madam Chair, I think realistically, it is personally identifiable information. When you take the first 3 letters of the last name and add the date of birth, you're going to get a huge percentage of those kids nailed right down. Huge percentage. So there's nothing secret about the information you're asking. And if you were asking for 1 date of birth, or if you were asking for the first 3 letters of the name, yeah, maybe you have a case. But you're just, again, I think dead wrong on what you're asking for. I guarantee you can identify who these kids are individually with those 2 metrics. You disagree with that?
No, I don't disagree with that.
And that's what you intend to do, actually. That's why
yes,
you don't
that
disagree
is
with
the
it.
reason that we need those identifiers, is because it's the minimum amount of information that we have previously found is necessary to match data across systems who don't have a common
So we might as well just give you
identifier.
the names and make it easy.
I think it's less risky to give us the first 3 letters of the last name and the date of birth than to give us the full names. But yes, the point is that we are trying to match the data across systems, and that is why we need those identifiers. But again, in the spirit of asking for the least amount of information possible, that's what we have after extensively searching for a way to match data across systems. That's the minimum amount we have found is necessary to match.
And I would contend it's probably cheaper and better if you were to simply survey your recipients in those other systems and find out if they have an IEP. Just take a statistically valid sample of the number of people that you have in program X and make an inquiry as to whether or not they have an IEP. That'll give you you can get the information that way. You don't even need a statistically valid sample. You've got plenty of data to find out whether and I still don't understand the relationship between the IEP and all the other services you're hoping or intending or thinking about providing, because the IEPs have to stand on their own. I mean, schools are responsible to live up to the terms of those IEPs, and there's been litigation of recent times to ensure that they do. So that's going to go on regardless of what you all do. And I don't understand why this is a significant data point. If you want me to guess, do a high percentage of the kids that you are trying to serve in other areas have IEPs? I'm going to guess it's pretty high. Why that information helps you is sort of beyond me, other than you might be able to wrap the school district into doing something. But I think our other experience that we've talked about at length in this board is school districts can only do so much. I mean, there are certain things that they can't do, and it's almost as if you're trying to wrap them into doing something else. And they have a hard enough time doing what it is we ask them to do.
Go ahead. I'd like to respond to that. I think actually what we're trying to do is provide better collaboration from other child and youth serving agencies to help relieve some of the stress that schools are feeling, that they're really not able, and it's not their responsibility. It's not the school's responsibility to address the child and family's needs outside of the education setting. However, I think many children have complex needs which are manifest both in the school and at home and in the community, and that's why there's a lot of overlap. Many needs that children have do cause issues within the school setting that require an IEP, but that same underlying issue that child may have requires outside intervention as well within the family and within the community. And that's what we're trying to provide more integrated care for the families so that what's happening within the school setting is consistent with what's happening in the home setting. And I've worked with a lot of schools, for example, who may have a board certified behavioral analyst working with a student in the school to address some behavior issues. But if the parents in the home setting are not able to use the same type of plan to address the student's behaviors at home, then it doesn't work as well. Because the child needs consistency between the interventions that are being received in the school and what's happening within the home. And so this type of support can help families be able to continue outside of the school setting what the child might be receiving in the home setting. And they may need community agencies and partners and natural supports to be able to continue that support for the student.
So hopefully this will be my last question, but if you were to write a 2-sentence summary of what you would know when you're done doing this and what you know now and what you're trying to learn, is that you're trying to determine the amount of staff you need to provide these wraparound services. Is that a good short capsule of what you will know after this, or hope to know after this, and what you know now?
I think that is the greatest concrete thing, yes.
So, well, I think Dr. Sheffield hit the nail on the head. You know, there are all kinds of ways to figure that out. You don't need this information.
Board Member Frost.
Well, you asked for 2 sentences. I have 2 sentences that I wrote about what I read here. And, because I like to condense it, you know, after I read it. And what I wrote is, the research is about high utilization students, or evaluation to improve services of a highly sensitive nature to improve the services to these students. The possible benefits that will be gained is worth the risk. And there is risk, but the benefits, you know, that will, I mean, I've been to meetings at the Denver Public Schools where teachers have been crying because they have all these students that it's hard to work with so many students in a classroom that are high risk and have IEPs. And I really believe that if they do this evaluation and they do find these high utilization students where they can, all these departments can come together and help them outside the school, that they will have teachers and administrators and other children will have better experiences in the classroom. So I see it as a very valuable tool for our schools and for less work for our teachers and our schools. I really do see this as very valuable work. And thank you very much. And they do say it over and over, that there is risk, but that the possible benefits, now again, it's possible benefits will be gained, is worth the risk. So, you know,
Any other questions, folks? Board Member Durham.
Dr. Flores, the answer to their question is one we already know. The answer to their question in terms of the amount of resources they need is more. It's always the answer. And that's going to be the answer to the question. You might try and quantify it some, but I know the answer to your question. Save a lot of money.
Well,
just go ahead and ask for more.
It may be less money. It could be.
This is government, Dr. Flores. It's not going to be less.
Well, could be more efficient.
So we're not going to vote today. I didn't hear of any questions for more information that any of my colleagues wish. So we'll see you next month.
Well, wait a minute.
Oh, did you have, I'm sorry, did
Well,
I?
I would certainly like a justification as to why a
sample.
random sample won't work,
Okay.
why it won't work.
I think
wanna
it,
see the justification.
it could work if we also, within that random sample, get the students
Let's
who
see it
don't.
in, let's have somebody who knows what they're doing, lay that out in how many other then records they would need of people who don't have IEPs.
We can bring that back to you.
Okay.
Great.
Yes.
Thank you very much.
Could I
Oh,
just say-
sorry. Board
So
Member Sheffel.
I still don't have a succinct research question that you're trying to answer, so you might draft that. I still don't know why you need PII data to essentially census the services that are out there that could collaborate to meet a child's need. I have no idea why you need to get PII data to figure that out. You can do a survey. You can ask districts what services are available in mental health and physical health and, I mean, whatever, you know, mentoring. I mean, do a survey. I don't know why you would need PII data to identify services available that parents who want to work collaboratively with 5 agencies couldn't do. So I think your research question is very vague, and it doesn't link to the data you're requesting.
But I would add to that, that it's not only about what parents ask for, it's what schools are asking for. I mean, I think
Yeah.
we have, if I heard correctly, you have some concerns of the kind of help that schools are asking for their students.
Well,
But-
again, they
But
could
the
survey.
question is a good question to,
Could ask the
Yeah.
schools what
Well,
they
yeah.
want or need.
I think that's
teachers
what they
won't be
say they're
crying.
responding to. Thank you.
Thank you. Thank you for your time.
Thank you. We'll call for a quick break.
Thank you very much.
Yes? I already got the other one. It was about the cookie.
Can we just have 5 minutes?
Yeah, I just said, I'm calling a quick break. I know, but I went ahead and drank your own coffee. All right, I'll have another one. Might not hurt me. Well, but they didn't say it, but it's also about where.
No, I
How much it's about where in the state are the big, so that they can cross. Here's what I have.
All by myself. There's a song, right? Maybe I should sing.
This is us, this is not them. To me, this is.
Yeah, specific time.
But that's the program.
No.
So. I don't know if I did it.
Missing pieces is that clearly there are a number of parents.
Okay, oh, no.
I do understand that.
And they don't even want to have these people, so I think
Right. As a presentation, whoops, it is not. I just lied. Next item on our agenda is consideration of the rules for the administration of medication. 1 CCR 301-68. I ask that staff give a brief presentation before I take a motion. Ms. Pearson?
Thank you. I'll turn it over to Mr. Ruthven to lead us through the conversation.
Thank you, Ms. Pearson, and good afternoon, everyone. Good afternoon, Madam Chair. So I will dive in. So this is an item that you've heard a few times before, so I'll do a brief overview and then ask if you'd like a little bit more information, if that works for you. So the current name is Rules for Administration of Medications. The previous name, as you remember, was much longer than this, so thank you to all of you for your insights in wanting to shorten the name and make it a little more streamlined. Really, thank you. This has been a group effort. Many folks, including the Attorney General and Melissa Bloom, have assisted with these rules. For today's rulemaking, vote, you have 6 documents, a memo outlining the needs and events that prompted rulemaking. As you'll see, there are 2 bills that require changes to these rules, which we'll discuss. A redlined version of the changes to the rules, a clean copy of the suggested rules, crosswalk of changes within Colorado statute, and then a response to comment. So we've had a comment from CEA, which you also heard publicly at the November hearing. You may remember that. And so we have a crosswalk in detail in general to address their comments. Additionally, Board Member McClellan had requested a response from the Colorado Association of School Nurses. That is also something that you have in your materials today. In general, you may remember that there's only one district that we're aware of that has adopted any type of policy to this effect. We're hearing from the vast majority of districts that do not plan to adopt a policy, and that is also the advice that they are receiving. So we will be partnering with CASB on this as well to help with a sample policy per your request. The general summary, if I may be so bold just to quickly summarize the Colorado Association of School Nurses is we don't love this, but it's in law. So that's, we don't love this, but it's in law.
Oh, okay.
So that's, I think, where they are, if I could state that. Would you like me to go through all the changes, Madam Chair, in the rules? I know you've seen them a few times.
Colleagues? No. Okay, no.
Great. So, so with that, I'll leave you, if you have any questions, a reminder of this is a majority vote in front of you today for these rules.
Do I have a motion, please?
I move to approve the rules of for the administration of medications, 1 CCR 301-68.
Thank you, Board Member Rankin. That's a proper motion. Board Member Flores seconded it. Any further discussion? Board Member Sheffel.
I was just tracking this young man in Loveland with cerebral palsy, and Representative Hugh McKean had brought up an issue with respect to that, and it has. So my question is there anything in the rules that would be allowing medication prescription or non-prescription to be applied by a trained designated staff individual if they're following the CASB guidelines? Is there anything in there that would allow that? And this has to do with these cannabis oils, I guess, that this young man is benefiting from.
And
And
you're
I
asking,
guess I'm asking if the rules would allow the school to dispense that.
without the district having a policy? I'm
Well,
trying
that's
to
what
figure out
I'm-
what your question is.
My question is, how could that young man be served at school? And I don't, as I look at the rules, I'm not sure the language allows for that. I think right now the school feels like they can't do it. And they want the parent to come, which isn't really viable if the parent's working. And so it's kind of an individual case, but I thought I'd raise it.
Sure. So if I may also turn to our Attorney General. So you're correct, Dr. Scheffel, in that one way would be for a parent, guardian, et cetera, to come and administer.
Right.
I think part of the piece with the CBD oil is it depends if it has THC or not.
That's right.
And if it does, then it would potentially fall under what we're talking about, right? So where the district would potentially need to have a policy, and if a staff member that was agreed to administer, right? So that would be part of that piece.
Right.
But then the other piece is districts already have policies around herbal medication. So if it was CBD oil that did not have THC, then it could be potentially considered herbal, and that would fall under a district's existing policy if they have one, if that makes sense.
So are you saying that it would be up to the district in that
Yes.
case? And it would be a
Correct.
different answer whether or not there was in that oil, what's the name, what's the acronym? THC. Is that right? And if there
Yes.
was or wasn't, what's the answer then? The school can still do it if it's in their policy or not?
Correct. Either way, that's the case, I believe. Would you agree?
No, that would be true. If it doesn't contain THC, it's not gonna fall in the category of marijuana in any regard. So it would just be treated the way they treat any sort of herbal, non-prescription substance on campus.
Mhm.
If it contains enough THC to be considered marijuana, and so CBD can sort of come in both
Mhm.
forms, then it's gonna fall within the definition of medical marijuana in a non-smokable form.
Right.
And it's either gonna be subject to that Jack's Law caregiver coming on campus,
Mhm.
or if the school district wants to authorize under the
Mhm.
statute that we're here for rulemaking, it would fall under there, but that is
Mhm.
gonna be up to the
But the
district.
board would have to, set a policy.
The local board,
The local
yes.
board, yes.
Mhm.
I just want to make sure that's.
So the relief for this particular case would be to go to their school board and say, would you be willing to do this? And I understand in this case, doesn't have THC in it. So the school board could say, we're still not doing it, or we are willing to
Sure.
administer it. Is that right?
It-
a highly utilized student.
Madam Chair, would you like me to address?
Please, go ahead, I'm sorry, go right.
So specifically, if it's CBD oil without THC, then it would potentially fall into the herbal
Right.
policy and guidance that
Right.
districts would either have or not, right? So
Okay.
again, it's on the district.
Okay.
There's nothing that mandates that,
Correct.
so probably should there be, so.
Other questions, colleagues? All right, there is a motion on the table. You want to call the roll, please?
Board Member Durham?
Yes.
Board Member Flores?
Yes.
Board Member Goff?
Yes.
Board Member McClellan is excused. Board Member Rankin?
Yes.
Board Member Shuffle?
Yes.
Board Member Schroeder?
Yes.
Thank you, that passes unanimously.
Good. Next item on our agenda is a request to approve notice of rulemaking for the rules of the administration of the Advanced Placement Exam Fee Program, 1 CCR 301-103. I ask that staff give a brief presentation before I take a motion. Ms. Pearson?
Thank you. I'm going to turn it right back to Misty again.
Thank you so much. So moving on, so today is a notice of
Notice,
rulemaking.
right.
Excuse me.
Yeah,
For
Go ahead.
for the advanced placement exam fee, for the rules for the administration of the advanced placement exam fee grant program. So for today's rulemaking hearing, these are new programs and new rules that came out of last legislative session. So you only have two documents in front of you. You have a clean copy of a draft of the new rules, and then a memo outlining the bill that passed, that prompted this program. A bit of background, the Advanced Placement Exam Fee Grant Program was created by House Bill 1396 to provide state funding for students receiving free and reduced lunch and schools with high poverty rates to cover advanced placement exam fees. In Colorado high schools last year, 50,000 students took more than 80,000 advanced placement exams, with 60% of students receiving a high enough score to receive college credit, which would be a 3 or above. 10,000 of the exams were eligible for a fee waiver or subsidy, which could be covered by this grant program in front of you. This law provides $500,000 annually, which would cover up to 7,500 AP tests, which is about 3/4 of the waivers that were granted last year. So turning your attention to the rules themselves, you will notice that staff have worked closely with the Attorney General's office to ensure the process for the application is streamlined. We also have reached out to district and school staff to ensure their input and work to provide an efficient process to make it easy for applicants to apply with their fiscal agent. In walking through the steps for the application, applicants are asked to submit the expected number of AP exams that students will take, and then they're asked to do that by April 1st every year. So students are taking AP exams typically within the April or May timeframe. And so this would allow enough time for districts and schools to let us know, here's how many exams we anticipate being taken, and then they would come back and just affirm that indeed that's how many exams were taken, and then we would essentially prorate the funds based on the available money and allocation from the legislature. So with that, if, again, if there aren't enough funds to reimburse, then we would prorate based on the total number of students that are taking, total number of exams that are taken, and then provide those funds in reimbursement form.
Who pays the rest?
Pardon me, Madam Chair?
Does the school pay for the?
So
for
how?
I mean, I'm trying to figure out whether the students are providing the money and then they get some of it back, or the districts providing the money and they get some of it back. I'm assuming that there's a higher number of applicants than there are funds.
Correct. So I think in anticipation of reimbursement, districts would essentially then absorb that up front. There is a reduced advanced placement exam fee for the waiver versus the full fee. So if a student's eligible for free and reduced lunch, they're already getting a reduction from the College Board through their advanced placement tests. And that's about $62 is the reduced fee. The full boat is about $95. So that $62 would then be absorbed by the district and then reimbursed by us, and or as much as possible.
Questions? Board Member Rankin.
So did you went through those numbers pretty
Yes,
quickly.
apologies.
60% of the students that took the test, of the, what was it, 80,000? Got college credit? Or was
Correct.
it 50,000?
So 50,000 students, 80,000 tests.
Okay. And so 60% of the 50,000 students.
Correct.
Okay. 10,000 were eligible for the grant. 10,000 students, correct?
Correct.
How many of those, what was the percentage of the 10,000 that also got college credit after taking the test?
That's helpful. We can look at the specifics.
And is this a test that you can take more than one time?
You would have to pay for it again.
Okay, so the person that was eligible via free lunch or whatever would be able to take it again?
So so I think what you're asking, does this address retakes?
Yeah.
And covering retakes?
Yes.
So we did not address that
Okay.
in the rules, and we did not anticipate retakes.
That's interesting. And
Yep.
I was curious, they have to be a certain level to be able to take the test. I mean, it's not like, well, now it's free, I'll just go ahead and take it, because maybe I'll pass.
Yeah.
Yeah. But I'm still curious as to of the 10,000, if the percentage is similar or how that shakes out.
We'll get you the specifics.
Yep, thanks.
Well, to address that, do we keep track of retake? Does the district keep track of retakes? Is this information that we wish to
That'd be
have?
interesting too, wouldn't it?
That'd be interesting, but I don't know if it's worth asking. Districts don't actually like to
Yeah.
provide data.
Right, and usually that would not happen within the same year, so a student would then wait the next year because there's one administration
right.
per year.
That's right.
So.
This will not affect my vote, but I am curious.
Actually, I have a question.
Board Member Goff?
Pardon me if you have referred to this before. Is it mandatory, is it necessary that a student have been or is enrolled in a current in an AP class to take the test?
No.
It's not, is it?
No, it's not.
So that's not a criteria or stipulation at all under this grant money, correct? In order to get the fee paid, it doesn't matter if they're in.
So while it's, you're correct. So while it's not a specific a requirement, I think that's what most districts would use to project what students would take the
Yeah,
test.
well,
There's
So
probably
it's
some
not
kids
mandatory.
who have to do it online, right?
Yeah.
There are probably some kids who have to take an AP class online or
Yeah,
find
but
some
it's
other way.
Still a class, I'm just curious,
Right.
if it would be valuable to know how many students are taking that test that have not been enrolled
Mhm.
in the class. It's not, if you can do it, I'm curious.
Yeah. We'll look into that. Thank you.
Any other questions? Have a motion, please?
Madam
Mr.
Chair,
Dorn?
thank you. I move to approve the notice of rulemaking for the rules for the administration of the Advanced Placement Exam Fee Program 1, CCR 301-103.
It's a proper motion. Do I have a second? Thank you. All right, so this is just for a rule. Anybody opposed to the notice? Unanimous. All right, the last item, no, it's not the last item. The next item is to approve the notice of rulemaking for the rules for the administration of Education Stability Grant Program for highly mobile youth, 1 CCR 301-104. I ask that staff give a brief presentation before I take a motion. Ms. Pearson.
Going right back to Misty again.
Thank you all. So again, these are new rules, and today's a notice of rulemaking around another grant program that was prompted by a bill from this last legislative session. This one is Education Stability Grant Program for highly mobile students. And before you are the notice of rules for administration of the Education Stability Grant Program for highly mobile students. For today's rulemaking, again, you have two documents in front of you. Since these are new rules, you don't have a red-lined copy, just a clean copy, and then the memo outlining the legislation, House Bill 18-1306, that prompted these rules in this program. So the Educational Stability Grant Program for highly mobile students is created to provide funding to assist schools and districts in supporting highly mobile students such as foster youth. The state allocation is $900,000 annually to assist 35,000 students across Colorado who are considered highly mobile. In Colorado last year, the graduation rate for the students this grant would support is around 50%, and graduation rate for students in foster care is at 30%. Needless to say, there are many academic needs that these students have, in many ways that districts and schools could use these resources in support of highly mobile students. Examples of how schools and districts may use these funds are to cover additional academic supports or other efforts to help students meet graduation and earn a diploma. So turning your attention to the rules, again, we have worked with CASB on these as well. And as a side note, they did support the bill across the street during the last legislative session. So they've been highly involved with this process. As outlined in the rules before you, this grant will essentially go through our normal competitive grant process. So it would be competitive, and we do anticipate a fair amount of applications for the limited funds, considering there are 35,000 students in highly mobile across the state, and they are across the state in both urban, suburban, and rural areas. So they're broad.
Applications by districts?
By
Or
districts,
by
by fiscal agent. So BOCES, et cetera.
Okay. Board Member Flores, did you have a question?
Well, I mean, I know that the federal funds are not enough, but in 1984, during the Reagan administration, I'm trying to think of the law that was passed. Julie, do you remember that? It's the two names, Bento.
Oh, is it McKinney-Vento? That's,
Yeah.
yeah, for homeless
McKinney-Vento.
students.
For homeless students. So I'm wondering if this is just not enough money from the feds, and so they're supplementing the money because it's needed. I'm just wondering how much money we get from the feds in that area, if it's known, and yeah, it's that Vento law. And-
Thank
and-
you. We can get you the specifics on that,
Right,
Dr.
and
Flores.
how that,
Right.
and in fact, that it also includes busing students to the school where they were at before, they became homeless and all that. And I was at a meeting and in discussion for this rule, and I thought, well, I don't have it straight. I couldn't remember the name, but I'm just wondering how much money we get through the feds for that, and how much money did you say was allocated for this?
900,000.
900,000, okay.
I think
Thank you.
The
Thank
new
you very much.
ESSA rules added something as well, if I'm not mistaken,
McKinney-Vento.
to our requirements of what we need to do. But I don't remember the specifics, do you?
I do not.
Yeah. Collect and report. So we didn't get any money for that.
McKinney-Vento Act, yeah.
Could I have a motion, please?
Thank you, Julie.
I move to approve the notice of rulemaking for the rules for the administration of the Education Stability Grant Program for Highly Mobile Youth, 1 CCR 301-104.
Thank you. That's a proper motion. Do I have a second?
I second that.
Okay. Any further discussion? Okay, this is just notice. You have,
I just had a
please.
question about
Sure.
a definition. Is this appropriate time? In the rules, or?
Sure.
What is a non-certified kinship care? What is that? Somebody in non-certified kinship care,
So it's a family member.
non-certified.
Mm-hmm.
What would be a certified kinship care?
So we can get you the specifics of those
Okay.
definitions. It gets pretty
Detailed,
complicated.
okay, and then
so.
social emotional support. I guess we could discuss it next time. Just what it is, I guess. How it's defined.
Well, go ahead and
Ask it.
ask it so
I just-
that.
those
they
two
have it
terms,
right.
the kinship care piece and then the social emotional support piece.
Perfect.
Does that mean if you're a mom, you're a kinship care? Say it again?
Are you
Kinship care?
certified or not?
You certified?
As a mother.
I'll mention that tonight.
Check that
When I
out.
go to my daughter. Make sure that my grandchildren have a certified kinship care.
That's
You're gonna
good.
need the non-certified care.
Damn right, I mean, that's, right, I'm not certified at all.
Thank you, Dr. Shuffle. That's
Yeah.
very helpful.
Okay, thank you.
Any objections? Unanimous. All right, so we're gonna have some more rules to talk about in 2 months.
Thank you so much.
It's full
Thank you
employment.
very much. Employment, yeah, I
Guarantee of-
know.
Guarantee of full employment.
So the next item is future business, and if I may, I would like to provide some background information for some upcoming stuff, and then I am certainly happy to answer questions, et cetera. So I want to share publicly with the board and the public the revised timeline for the accountability rules. I know this is a great topic of interest to districts, educators, community members, and the state board. There's already been a lot of background work that has begun, including stakeholder and community engagement. Because we wish to be thorough in our revision, in addition to these rules, we've decided to make it it would make the most sense to make some changes in our timeline. We have some important policy decisions to make with these rules, per the changes made in House Bill 1355. I want to make sure that we have time to hear all the different perspectives and analyze data before getting it too far into the process. At our next board meeting, February 13 and 14, CDE will give a short informational presentation explaining the purpose of the upcoming accountability work session meeting that will take place on Friday, February 15th. CDE will also explain the content of the rules, present the preliminary feedback received up to that point, and the timeline and process for approving the rules. At the February 15 work session, CDE staff will cover the school and district performance frameworks and topics included in 13-1355. At the March 13-14 board meeting, CDE will give a brief presentation of the draft rules and ask the board to approve the notice of rulemaking. And at the May 8th-9th board meeting, the state board will hold the first of 2 rulemaking hearings. Again, because of the interest and enormous overhaul to these rules, we want to make sure there are plenty of opportunities for public feedback before finalizing the rules. At the June 12/13 board meeting, which will be in Salida, the board will
really?
hold second rulemaking hearing and possibly vote on the rules. If the board approves the rules at the June meeting, the new rules will be in effect August 2019, but would not impact school and district performance frameworks until 2020 at the earliest. The board's accountability procedures will be updated accordingly, including the request to reconsider process. So hopefully that will help give some idea what we are about to do. So in addition to the accountability rules for our next board meeting, we're also going to look at our administrative procedures for accountability hearings, and this relates to the change in the law that allows districts to come forward to us before the deadline that they now have, and we need to include that into our procedures. We'll also be looking at Pueblo consideration of their external management organization for Heroes and Risley schools. We'll also hear from Hope about their revised accountability plan. For rulemaking action, we'll have notice of rulemaking for educator effectiveness rules Educator Licensing Act of 1991, educator licensure endorsements, and rules for the administration of early colleges.
When is this?
February? I'm just talking about mostly
Yeah.
upcoming
Be nice to
February.
read it.
So also, we're going to have a request for exclusive chartering authority from Roaring Fork School District, either in February or in March. That's still to be decided.
And what is the school district?
Roaring Fork.
Roaring Fork, thank you.
We have additional research. No, I think we'll vote on the research request we heard about today, if I got that right. Recognition of Colorado Teacher of the Year. And then before the March meeting, we will have additional special meeting on March 1, which will be the legislative update. We're also going to have a legislative update on February 24?
That's the one that's moved to March 1st.
Oh, that is the one that moved to March 1st, pardon me. Okay, so we don't have much to do in the future, but what else would you guys like to be doing next month?
Next
Could I
month or
report on-
future?
Why do we?
Well, both, but next month or future, go ahead. Board Member Rankin?
Is that okay? Earlier yesterday, we heard in public comment about a parent and community's desire to have more parent and student-friendly choice enrollment processes across the districts. I brought this up before, and we did discuss it before, but I needed to bring it up on the mic. I think one way we could take a step to support that request is to look at states that offer common enrollment applications and then put together a template or a prototype for districts to consider for their local choice enrollment forms. What this does is put a window on the time that parents can choose a different district or school for their student. Right now, the times and dates are so different that once a parent decides, sometimes it's past that date. Some states have already, by law, approved a certain window that all districts across the state would adhere to, and then since it's universal, the parents know exactly what the dates are. Ours are so different that it makes it difficult for parents. Some don't even know they have that choice. The idea of the template is that some districts might want, it's going to be probably, hopefully, a very simple template, not a lot of detail in the weeds that parents can understand. And for their district, if they miss the date one year, at least they will be attuned to it for the next year, unless something comes down from the legislature before that. But this would just be a template the districts could use. If my colleagues are okay with it, I'd like to ask staff to do some of this research, put together a prototype that districts could have access to, that could serve as a resource for the district in thinking about ways of having more consistent application forms.
Thank you.
And I have a couple more. You want me to just keep going?
Let's just go with this,
Okay.
get an answer
Oh, okay.
on this one.
Sure.
Is Commissioner Anthus aware of this request and you're already on it, or should we formally be asking?
I think that's what we're getting the request right now, so if you
Okay.
all would like us to do this, we can start working
Okay.
on it.
Yes, nod?
Yes.
In addition to other states,
Yes.
I think I'd be interested in knowing just other districts, because we're all over the map in Colorado.
Yes, we are.
And how sophisticated,
And-
what the timing is, et cetera.
I believe that our CDE will look internally within our state and then also look
Outside.
because some of the other states have really simplified the form too, so I don't want to limit it just to what our state has.
Okay.
But I think to make that something that everybody, parents, superintendents, boards, school boards have access to, they
Right.
might find that useful.
It would make it a lot easier to notify broadly
Yes.
that this is coming up, so it has a
Yes.
real advantage. Did somebody have a question?
That's basically it. She answered it.
Okay.
Jefferson County just unveiled and launched a
Right.
brand new system for that, so I can't give any extra
Yeah.
view on it yet, but my question would have been, how many districts in Colorado have a form they use? How many different ones are there, and would this benefit? So, that's fine, that's my question.
Thank you. It does possibly get a little more complicated than that. in that some districts, I believe, require parents to visit the school in which they indicate an interest. Others don't. I mean, I think we'll learn this, but there are different expectations at the different district levels.
And that's a good question, Chairwoman Schroeder. And I think that those are going to come forward. I think more than anything else is the window of dates. And district to district, it may be more detailed what the form is. But if the dates are closer to universal, which would be something I would really want to look toward, I think it's going to be so much easier for the parents. And yesterday, I think the lady that spoke at our comment time, Juliet Siebold, I think she made a good argument for this type of thing because people just don't even know about it in our state.
And I'm not sure how well even the districts publicize to the parents that it's open enrollment time.
Yes, I think you're right on
And I
that.
think there's one or two districts that require all parents to enroll their kids.
Denver.
And then others where only if you want to go to school other than your neighborhood school. I mean, we're just sort of,
We're across
we're
all over the
innovating.
place. Yeah, yeah.
Innovation can be really complex. Any other comments about future items? Board Member Goff?
Yes, I really can't say this is a concrete request. I know I've brought it up to you in the past sometime. I think, I don't know what to call it, other than an update on our chartering group's quality standards. There's been a lot of work over the last several years from charter advocacy, but also charter school people and parents and community groups. And the organization, nationally, it's called NACSA, the National Association of Charter School Authorizers. There's also a Colorado chapter. Just throwing it out there as an idea. I'm not really being a proponent one way or the other for this, but the NACSA especially has continuous work on their standards for criteria, standards for quality authorizing, and they also offer a lot of training and open up possibilities for local districts or any other authorizers. So I just think sometimes maybe it would be good to get an update on that, a reminder of how that works. Perhaps it would be beneficial in some ways as a community education opportunity, just for the good of the group, so to speak. So I have no particularly preferred time or date and no call for it. So
We'll put it on our wish list, and then we
yeah,
have
that
time
would
to
be a
bring it in.
good term for it.
I would like I'd like to assure myself that our rules don't in any way the rules that we've passed don't in any way conflict. I'd like to think that we're all on a similar page, that our rules align with what are the recommendations from this group. It is a good group. I think that could be helpful. There might be some places where, based on experience, we're all learning, as 25 years probably hasn't been quite enough yet to learn all the ins and outs of what we ought to do to have good charter schools, but that might be helpful. If you could put that on our wish list, please. Board Member Durham.
Thank you, Madam Chair. Last month, Dr. Anthus and I visited Liberty High School, and you were unable to attend.
I
and
wasn't.
and Dr. Anthus got sick during the trip, so it was challenging. But it was a very interesting, very good trip, and I would hope that perhaps if we could persuade former member of this board, Bob Schaefer, to host us one more time, that perhaps a couple of members go up. I thought it was very worth seeing, some
I've been
very
there.
innovative things. And
I have
and-
visited, because that's one of my constituent groups.
Right.
So I was anxious to
I know
see.
you were, you were,
see it again, but
you had some mobility questions.
yeah,
And
kind of.
So anyway, think about getting that done sometime in the future. I think it'd be worthwhile for any of the board members as possible to take that tour.
Good, that's
Thank
great.
you.
Yeah, I'm sure it's true. Board Member Schaffel?
Yeah, I don't know if we have too much on our plate already, but I would and I don't know if this would be around a study session or something, but just the whole issue of screen time in schools. You know, this whole issue of not online education, the role of technology, how many hours kids spend in front of a screen, even to just expose the research or something, just because it just remains such an issue, and I think it will increasingly become more of an issue.
I think that's been mentioned before.
Yeah.
I think it's both screen time and devices in school. These are areas about which we don't necessarily have authority. However, if we wish, we could provide guidelines. We could make.
I understand.
I'm not sure I understand.
Me neither. Sorry.
And there may be some things that we would ask of the legislature.
Yeah.
But you're right. The research, unfortunately, is still pretty young.
Equivocal, it's here and there.
It's, yeah. And what worries me quite a bit is that in some schools, the private devices that kids bring are actually being used in learning. And so for us to interfere with that would be problematic when in fact there aren't other resources for the kids to get those learning opportunities. And in other schools, it's just really not necessary for the kids to have their own devices in the classroom. So, but I think it'd be a very good topic. I've been thinking about this a little bit in terms of how to structure sort of the investigation. I'm not sure I want to necessarily ask staff to do that, as opposed to maybe we ought to have a citizen committee that it might include some staff folks, but also include some experts, parents. Might want to think about that and might have recommendations from you guys, a way to do this. I don't know if that's a SACPI opportunity. That's the, I hate acronyms, but it's the parent group. It's the parent
group.
State.
SCASB.
SACPI. I just know SACPI. That's all I can remember.
It reminds me of something else.
But, yeah, I'm a little worried about just asking staff to do all the research on this. I think it probably ought to be a broader input and get some kind of expertise, medical expertise, et cetera. Board Member Goff.
Speaking of SACPI, I did read through the their legislative report, their year-end report, whatever it was. I am aware that particular committee is not state board established. It is not put in statute by the state board. We only have two, if I'm right. The SEAC is our assignment, and the GSAC, which is the Gifted Education Group. Those were established under the state board's authority in statutory language. So that's why our two liaisons to those committees they're a required part of our structure. But I wondered if right offhand, are there any other committees that do have a state board liaison? Informally?
I don't know if it's not formal, but early childhood. There's an early childhood group. And I don't think any of us.
Is one of us.
Used to be.
Yeah.
Used to be one of us.
I thought invited.
Yeah, I thought you.
But that's
participated in that.
NASB. I thought you were saying.
No.
Statewide.
The state one.
Oh.
Evie Hudak used to be on
Yeah.
that, and she was after me to do that.
Anyway,
I
a thought
didn't.
I had was, seeing as how the whole idea of parental engagement, family engagement, involvement, whatever word we're throwing around any day, keeps coming up, and I'm kind of assuming, maybe wrongly, that we're going to include that in our retreat agenda. But the whole picture of that, it's in our legislative priorities. There's reference to it. We have it in so many things. We have SACPI, which is in and of itself sends a message. I just wonder if we ought to consider, and how that would be done, I'm not clear on. I haven't gone that far. But to consider having a in-place state board liaison to that group. How informal or formally that has to be done, I don't know. But
Was
if
informal
we're-
because Evie Hudak did that too.
yeah, and it's a big part of our ESSA work. It was a major focus point in that planning and
She
in
would-
our general thinking, I think as a board we care about.
Shall we bring that up as a discussion item when we have a little space
That would
on
be
our
fine.
agenda? Is that okay?
Sure.
Okay. Anything else? Board Member Durham?
I think we ought to ban these devices, but, from this meeting, but.
Well, you'd be the first one
yeah,
to.
be banned, I know. But.
You and the device.
Perhaps we could, if, maybe staff could give us, I'm sure they have people who are interested in this, if they have a short reading list that they might suggest to us, some.
That's a good idea.
Yeah, that, I would appreciate that, thank you.
Or screen time
Mhm.
stuff?
Oh, and
Yeah, it's kind of a
there's
resource.
a lot.
A lot out
Nationally,
there.
there's a whole growing digest.
There's a lot of
short
stuff out there.
People that you think, you have some staff, I'm sure, have looked at some of this, that they think might be relevant.
On screen time?
Screen time.
Okay.
I think there's some parent groups that have been looking at it as well, if I'm not mistaken. Board Member Rankin?
Screenagers.
Oh,
Are you
I
kidding?
have one.
Teenagers.
I have another.
Uh-oh.
Yeah, of interest. Yesterday, public comments were interfering with the quasi-judicial status. And I think that some people in the public that want to come in here just don't quite understand what that's all about. And I thought Vice Chair Durham did a great job of kind of stopping that, but it still was not understood by some of the people in the audience. So I think we need to make it very clear that if we're in quasi-judicial status and they cannot talk about something, they could still turn in some papers about that, and when it's appropriate, those can be passed out to us, so that some of the things that they're talking about, after this is all over, their voices can be heard, and I think that's very important in the public, and I thought that was spoken loud and clear yesterday.
So my question is, if I understand what you just said, even though they can't come and speak to a topic that's before us, that they could give us materials and that we would be looking at them at the last minute?
No,
prior
we
to
will
the
be
hearing?
looking, if we're not allowed to see them, we will not be looking at them. For instance, let's take yesterday
Yeah.
into consideration. There were some papers that the people wanted to pass out, and Board Member Durham, Chair Durham yesterday, had busy hold those so that we didn't get those illegally. But then there was another lady that didn't get a chance to speak, but if she would have had some papers in her hand, Ms. Cordial could have held those too, and today possibly. I worry about not getting some of those comments, even though it's after what we had, because legally we cannot hear those comments. I think those comments still are important enough for us to see, because the people came down and were important enough
Right.
to share them with us. And that may be my opinion, but I think legally that would be a better way of dealing with it.
I think that would work just fine, because, certainly your constituents want to tell you, we like these kinds of programs, or we want you to defer to our district, or whatever they want to say. Just get it out of the context where those comments are being considered in connection with the hearing. I don't see it as a problem.
So, Counselor, would it make, we have a sign-up sheet out there. Would it make sense to have a fairly large sign there that says, for this particular topic, any input today would need to be in writing? Because today is the hearing. I mean,
And
I'm trying to figure out how to communicate.
And no presentation. Well, you could just state it.
Right, well, the sign would say, you may not speak to this, so don't sign up to speak to it, but your written comments would be welcome and will be shared with the board later
Right.
today.
After the decision's
After the
made.
decision's made.
That would work, or invite them they can come make their comments next month and tell you why
Or
you got
next
it
month.
wrong, or whatever.
Well,
I mean, however
sure.
they want to,
Right.
I mean,
do
the
that.
notion of understanding what quasi-judicial blah, blah, blah means,
It's complicated.
it's complicated and it doesn't feel very welcoming or open. I'd rather be able to say that this is the situation, but if you would like to provide your comments in writing, please do so. They will be shared with the board after the hearing. Or you can come next month. I mean, if that's,
Well, also, we have to consider that either let them know that the time has passed for them to write letters, because we can't have Carol and Busy answering the phone and getting these very irate people. Yeah, who, or just, want to get their point across and then argue when they say we can't accept it at this point because the time has lapsed. That should have been, we should have gotten that. But they also need to know, we need to send it out somehow in writing for those people that keep up with these things, that this is the time, and we will be receiving information up to this date. And I think
Would it be helpful to notify the districts that are involved, to notify the superintendent? Look, if your citizens want to provide input, written input, now is the time. Here's Busy's email address. I mean, I'm trying to figure out, it feels like people don't know how to provide
Yeah,
input so that
because,
we hear it and
because
see it.
last night when I was being hammered about, why did you do that, and I gave an explanation why I voted for it, and I said, but the time had lapsed, and then they were coming back, well, you didn't hear me, and it was unnerving for me too. So I can only imagine from what I got, what, the people our people at CDE
Right.
have to deal with.
Board Member Goff.
Yeah, where do I start on this today?
I don't know,
I just
but
think
I'm getting nervous.
Don't worry. Relax. Quasi-judicial, there are more than one circumstance where that term applies. It's a little bit different when we're talking in terms of our accountability hearings than it is in a charter appeal, for example. I think maybe someday maybe we could talk about even a short webinar. I don't know. Try to get something out there, and if the primary audience at the first is school district personnel, that would be helpful. It's a good start. But I do think the public needs to be eased into a better understanding of this. I think it would help all of us a lot. Yeah, I think the whole other corral is the timing of who can put comments in up to when, and when does it have to end and all. I think that's a whole other fence for the detail. But
Yep, I agree with-
I think some public education needs to happen.
Yeah, but you are right about that. School district personnel do not know this.
No,
Because
and
we are
that's where the problem
contacted, and when
starts.
we say, sorry, please send it in writing, they are
Madam Chair,
irate.
I have a suggestion also. When we put out the agenda for the meeting, the information, what is it, a week before? If there is something that's
That's a good idea.
quasi-judicial,
Yeah,
it
that's a
should be
great
there,
idea.
or where it says public comment, this is cannot be discussed. Because it's too hard for people to see something, public comment every month, and then they come, and then they can't talk. But if we put it on that agenda, I mean, we've put it out there publicly. I think that's all we need to do at this point, and maybe out front when they're signing in.
We have started doing that because we've gotten this kind of confusion out there. So on the notices that do go out and get posted on the doors, it does say
Good.
The board can't hear quasi-judicial matters. I think we could, I don't remember if we're completely specific, like, for example, today, the board can't hear this if we have one
Mhm.
on the agenda, but we could start doing that. I know we do that in Angelica's script, in the board chair's script. But we are trying to be more clear about when and what the public can speak to, so.
It's only fair. Thank you.
Yeah.
I think that's good.
Ms. Cordial? So before I ask you to announce an executive session, I'd like to let the public know that the following executive session, after the following executive session, we will stand in adjournment until the next board meeting of the State Board of Education, which will be on February 13th. So please proceed, Ms. Borgel. I.e., we're not coming back.
An executive session has been noticed for today's State Board meeting in conformance with 24-6-4023A CRS to receive legal advice on specific legal questions pursuant to 24-6-4023A Roman numeral 2 CRS and matters required to be kept confidential by federal law, rules, or state statutes pursuant to 24-6-4023A Roman numeral 3 CRS.
Do I have a motion, please, to go in exec
So
session?
moved.
Second from Board Member Sheffel, Board Member Goff, we're seconded. Thank you. Thank you for coming, folks.